All right, so what's up, everyone? Dr. Frank Garza here again with Pure Physical Therapy, and I am going to shoot a quick little video discussing the anatomy here of the foot and ankle. So I got a little software program here. I'm going to move this way, over here down to the right. So I have a little software program here that shows all the anatomy and the human body. So currently, right now, I'm just going to take out everything. So this here, you're seeing the bones. So as you can see, the foot and ankle is a very complex uh, bone anatomy, as it has several pieces. So as you see here, it has one bone here, the calcaneus. You have the tarsal tunnel or the talus, the tarsal. You have the navicular. You have the cuneiforms, and that's just one side. And then the tarsal of the first digit, and then the metatarsals, or the digits and whatnot. So all these different bony landmarks. So these are all individual joints of the foot, and that's just one side. And then you can turn it around. You can see, yeah, for the toes and stuff. So it's very complex. You got the fibula and the tibia here that are also working together with the talus to perform the ankle movements. So obviously, one of the most severe uh, problematic, areas of the foot and ankle as far as pain and rehab is fractures of any of these bones. So, that's one thing that can be causing pain or problems. But a lot of the times, we see those individuals after they've been casted and immobilized, which now at that point we're dealing with hypomobility issues or things of that nature. Because the bones here, understand that the bones here have to slide and glide in certain ways to be able to perform the movements of the ankle. Okay, so one of the issues that could be happening is if you've had issues with fractures in your ankles and you're having pain, then yeah, definitely you want to get it checked out by a movement specialist or a physical therapist to see what we can do for you. But I want to go ahead and add the muscles. So there's, those are the bones. These are the connective tissues. So these are the ligaments and things that hold bones together. So if we didn't have these tissues here, then where would our bones be? So it keeps them stable, keeps them in line, keeps them, from excessive movement. But when we sprain something, we're mostly talking about this tissue here. We're spraining a ligament. So your high ankle sprain, your normal ankle sprains, your rolling of the ankles, those are the tissues that get hurt here. So if you have children that are in sports and they've fallen or they've rolled their ankle several times, they're stressing these tissues here, the ligaments. And the important thing to note about that is that these ligaments do not have rubber band properties. So in other words, if they stretch, which happens when we strain a ligament, they don't return back to normal. So a stretched ligament is a lax ligament. It stays lax. So, if you have a history or if you have a child with repetitive ankle sprains but hasn't really stabilized that joint really well, then they're more susceptible to future reoccurring ankle sprains. So look out for that. But for the most part, most individuals, past, in their middle ages that are maybe doing some running or some working out on the side, maybe not high intensity, or maybe they are doing high intensity. What I have found is the most common cause of foot and ankle pain in these individuals is mainly caused by the plantar fascia. So I want to go ahead and show you what that is. Okay, so I'm going ahead, I'm adding muscle groups here. I think it's already in there. Let me see here. Yep. So this tissue here, that's your quadratus plantae. Okay. So then that's kind of like the plantar fascia's secondary muscle. Okay. And then, and then here's more flexor digitorum. So these are all the muscles that go on underneath the foot that cause these to flex or bend. Okay. And then there you go. All right, so let me see here. So there's your adductor hallucis. Okay, so that's all the muscles already. So that plantar fascia muscle that I was talking about is going to be right underneath some of these muscles here. So I'm going to go ahead and zoom in here so that you can see that, and then I'm going to retract some of these muscles. So there's that right there is the plantar aponeurosa, okay, or the fascia, okay, that we call the plantar fascia. And this here is that thick band of connective tissue that supports all the underlying muscles, okay. So these muscles here, the adductor digiti minimi, you know, the flexor digitorum brevis, you know, the adductor hallucis, all those muscles are underneath this plantar fascia, or the, you know, the plantar aponeurosis. Okay, so that's what we talked about when we're talking about the plantar fascia. This is also another, uh, you know, area. This is the muscle part of the plantar fascia that can sometimes get irritated. And why is it that we have heel pain? Well, you know, when that's irritated, then all these muscles get irritated. And look where all these muscles attach. They attach right here to the calcaneus bone, and that calcaneus bone is your heel bone. So a lot of the pain sometimes originates here, okay? And that is why we get that first initial pain in the morning. That is why we get pain with long periods of sitting, long periods of standing, high dynamic activities. But that's the tissue that's impaired. And what needs to happen is that we need to regain mobility in all those tissues. We need to regain strength in all these tissues here in order to get ourselves back to living the life that we want. When that happens, all these muscles and joints get hypomobile, or there's not enough movement allowed. So we need to go in there and mobilize those joints as well. So there's a little bit of anatomy on the foot and ankle. I hope that helped. Sorry if that took a little bit there with the clicking and the computer, but hope it was helpful. If you have any questions on it, please make sure you email me with the questions, concerns. If you feel you have plantar fasciitis or any other sort of heel or ankle pain, please reach out to us. We can definitely help you get that better and get you back to living the life that you want. But most importantly, preventing it from reoccurring by doing a thorough evaluation and assessment of your foot and ankle and all your movements patterns. So thanks again. Workshop's coming up soon. We'll see you there.